Most people don't like the sight of blood, and particularly their own blood, and probably even less so if it's coming perhaps from the rear end. Hi, I'm Dr. Joe, and in this video we're going to talk about the perhaps not so glamorous but very important topic of bleeding from the anus. Now, first and foremost, this is a fairly common phenomenon. Through the course of one's life, it's fairly likely that at some point in time, when you sit on the toilet, there will be some blood that comes away. Now, obviously, in a once-off situation, for the vast majority of people, it's not going to be a problem. So, what do we need to do about bleeding from the anus, and how can we start to sort out when it is versus it isn't a problem? Okay, first and foremost, when we're talking about bleeding, that surprisingly can mean a few different things. How much or little blood there is. Is it separate to the bowel motion, or is it sort of mixed in with the bowel motion? Is the colour bright red, or is it a darker colour? All of these things have some significance. Presence of other symptoms is important as well. If when wiping yourself you notice a lump or a swelling, or if there's pain down around the anus, again, these things are significant and pointers. So, what are the common causes of bleeding from the anus? Well, far and away the commonest two are hemorrhoids and anal fissures. Now, a hemorrhoid is like a varicose vein, but happens to be at the anus rather than in the legs. So the blood vessel swells a little bit, and then some of that blood gets trapped in the vessel. This will typically present as something that's sore and painful, and a bit of a swelling or a lump. Now, that's if it's an external hemorrhoid, i.e. outside of the anus. People can also get internal hemorrhoids where you may not feel the lump, but you will get the bleeding. Typically, it's painful when you're passing the bowel motions. Fissures are tears in the lining, and you can sort of think of it as sort of like the equivalent of a mouth ulcer, but at the far end. These also tend to be quite painful, particularly when sitting on the toilet, and will also be associated with blood. Now, this blood will typically be bright red, a bit like you've cut yourself blood. Sometimes people just notice it on the paper and nowhere else. Now, again, if this happens in a once-off situation and never again, it's not particularly a cause for alarm. There are, however, other causes of bleeding from the anus which can be more serious, and the one that people worry about, obviously, and rightly so, is bowel cancer. Now, most of the time, bleeding, if it is from a bowel cancer, will tend to be more than a once-off, and there generally won't be any soreness or pain around the anus. The blood may be a little bit more mixed in with the stools. Unfortunately, these things are not absolute, so certainly if bleeding is going on for more than a few days, it is worth going along and seeing your doctor. That doesn't mean there's a major problem, but it does mean that you should get it checked. Other simpler causes can be in association with diarrhoea. Sometimes if people have polyps, which may be benign growths within the bowel, then again these can also lead to bleeding. All right, in simplest terms, what are simple measures we can do if we do have some bleeding? Now, the most important thing is to think, well, why might this have occurred? And certainly in Western countries, the commonest reason for bleeding from the bowel, which as I said, was related to hemorrhoids, is if we're having to push or strain with bowel motions. So making sure you're drinking enough water and having plenty of fibre in your diet is important. Now, people will sometimes say, well, I'm getting enough fibre. How much or how little fibre you need is not a function of what you think is the right amount, it's a function of what's going on at the far end. If you're eating every day, then in the normal course of events, you should be going to the toilet once a day, and there shouldn't be any effort involved. If on a regular basis you're really having to push or strain to move things along, then the gut is having to work harder than it would like to, and again that's a signal that the body does require more fibre and probably more water. Things like hemorrhoids and fissures can be treated fairly easily, and there are some over-the-counter preparations. Again, if it's not settling, then certainly see your doctor, and there are some items on the prescription. If bleeding is continuing, or if it's a darker colour, or if it's associated with perhaps pain in the abdomen or other symptoms of concern such as nausea, then you certainly need to go and see your doctor, and this may well need to be investigated. The sort of test that's most likely to be done is a colonoscope, where a tube, and this is, you'll be pleased to know, is done under sedation, is inserted, a flexible tube is inserted into the anus, and a gastroenterologist can have a look through the bowel, sort of like a telescope, and see what's there. Now again, in most instances, there may be nothing serious, and that's a good result. Equally, if there is some early cancer or something else that needs treatment, then it's better to find out about it sooner. Okay, so to summarise, bleeding from the anus is going to be fairly common. It is potentially a sign of something serious, but in most instances it won't be. Does that mean you should ignore it? No, it doesn't. Can you do simple things first? Absolutely. If those simple things are not bringing about improvement and resolution, then that's the time to go and see your doctor, and in some instances further investigations may need to be done. But the key message is, if you can keep your bowels regular and making sure you're getting enough water and plenty of fibre in your diet, your chances of having bleeding is going to go down significantly.